I'm going to share the screen because I've got a PowerPoint. And let me say, I chose the title, The Arc of a Career, after talking to Tim and saying that I'm now turning 75 this February. And I have pretty bad arthritis. I'm not complaining and just reporting, and a couple of other health problems. So at a certain point, it became harder for me to travel to like northern Nigeria, for example. I still could do it, but I felt that it would be better. Robert and I are parents of a daughter who was at that point in late high school, and she really needed me at home. I don't know about you guys as parents, but and our daughter turned out beautifully, I'm happy to say, but it was touch and go during the teenage years. I did not feel that I could be absent from that child for a long period of time. So I decided, okay, what do I do? And I read Arthur Brooks, who was at Syracuse University, and he said there's an arc to a career. And if you kind of plan on it and think about it, you can perhaps keep going with the skill set that you still have and the wisdom that we've all accumulated. So I'm now a member of the ASA, if I get the acronym correct. And so I'm your newest member and glad to join you. Okay, so what is this? Okay, somehow. Okay, so what I did with Robert, this is the two of us, we developed a model of field school at home in Syracuse. Syracuse happens to be a city with a lot of public health and community health problems. So we developed a model called CARE, Community Action, Research, and Education. It is inspired greatly by the Fox project, if I'm correct, by Saul Tax. It's based on action anthropology from anthropology and community participatory research from public health. We try to be absolutely equitable with this project. So we get research questions from the community. Actually, after starting Healthy Start, I got to know everybody in the community. Not everybody, but it's a small city. And people would say, oh, Sandy, could you help us with this? Could you help us with that? And I would always say yes. And then I would ask, could I bring my students? Yes, you could bring your students. So I'd bring students, and then the community members would be equal to me and Robert as the PI. They would be co-PIs with us. And all publications, results, etc., would be shared. Everybody gets to be a co-author. And then another couple of things we did is we tried to figure out what the community members needed to make their work better. We recruited some of them to come to Syracuse University. We helped others to apply to other colleges. We helped two of our groups to start their own not-for-profits, 501c3 agencies. So we've tried to empower our community partners. So you can tell that this is based to some extent on reciprocity. And I, as a graduate student, read The Gift by Marcel Mauss, and I was very impressed by it. And I've tried in my research overseas, and Robert and I have done this together, to be much more reciprocal and equitable with the people we work with. So I have to give a shout out to Saul Tax and Joan Ablon, who is my professor and is my dear friend. And they taught me action anthropology. So, and then here's Robert and me. I thought, well, you guys all know Robert. This is a wedding picture for us. You can tell we were kind of hippies back in the day. So here we are. And these are other people that we work with. Oceana Fair over here, Dr. Andrea Shaw, Love Moiti, Tina, who just got remarried, and I don't know her new name, Leo Rose Noble, who's his nickname is Noble. His real name is Timothy Jennings Bay, and his wife, Naja Salam. They work with us in various projects, and you'll hear about those projects. And this is some of the kids that we've worked with, and that's with Noble and Naja on the Street Addiction Institute Incorporated, which you'll hear about. So we've worked on a bunch of projects. It's almost 2 decades now. But Food Deserts was the first one, excuse me. Then Healthcare for the Uninsured, lead poisoning, violence, although this goes in the wrong order. It's supposed to be violence, lead poisoning, and refugees. These are the ones that I'm talking about today. So first, we were invited in about 2003 by community members who said, Sandy and Robert, there's no food out here. We need better food. I said, okay, tell me what you're thinking about, because I hadn't actually really paid attention to retail food availability in Syracuse. So we designed a project that had a community member and 3 students, and we had four major types of methods. The first was participant observation. We went shopping with community members. We tried to figure out where did they buy their food, how did they drive there, because in the wintertime when it's snowy and there's single mothers with 2 kids taking the bus and then taking your groceries home on the bus was really hard. So first we looked at the supermarkets, then we looked at the corner stores, which are wholly inadequate, and then we looked at the lotto. So I'm just going to kind of run through it. We had a database that we had put together for another project. I'm very good at recycling databases. This was all the births in Syracuse. So we divided the births in Syracuse. This part was the epidemiology part. Divided the births in Syracuse into 2 groups, those with a census tract that had a supermarket or within half a mile and those that didn't. The short story is that, first of all, when we just looked at race and Medicaid as a proxy for poverty and race as a proxy for racism, not that we think of race as a biological variable. We don't. We follow anthropology in that regard. When they were both significantly associated with this kind of low birth weight that we looked at, when we added supermarket to the analysis, both race and Medicaid became not significant. So what this slide tells you, if you're an epidemiologist, and I get that many aren't, and that's okay, is that if a mother gives birth to a child while living in a non-supermarket census tract, she is likely to have almost 3.4 times the risk of low birth weight, which everybody probably realizes is a really bad birth outcome. We wanted to be able to have a health measure that would make people pay attention to. So that's why we chose low birth weight. Then we chose randomly 38 corner stores. The corner stores in Syracuse are truly, truly terrible. And we decided that and with the students and the community members helped set everything up and pretest all the elements of the research. So we looked at the corner stores as if they were individuals in a research project. So we looked at what they sold, what they didn't sell, various items that we could count, like were any of the food that they sold, food items out of date? Almost all of them were. So they were selling things that were already too old to eat or drink. How much did they have of non-food items? And here I have to tell you a story. I was pre-testing our instrument of data collection with 2 of the students. And I said to the students, what are those little tiny pieces of paper on the floor? And they looked at me as if I had 2 heads. They said, Dr. Lane, that's the lottery. I said, they sell lotto in here? Of course, everybody knows that happens, but I didn't know. So Robert and I quickly did a Freedom of Information Act request for the lottery, and we got that. So let me give you the answer of what we found in the corner stores. Each corner store had at least two people who filled in the data. We found little or no fresh produce. Mind you, they are licensed to sell food. Very little low-fat dairy, lottery tickets, mentholated cigarettes, which we know are marketed disproportionately to people of color. Sale of Lucy's to children, which are cigarettes that are sold separately, 5 cents each. Sale of blunts, which are the kind of cigars that are that have flavors like pina colada and Coca-Cola and chocolate. And those were used as a way to wrap marijuana joints back in the day. Alcohol items, the stores were also a bad locus of violence. And they sold under the counter, they sold drug paraphernalia. And so the stores could not be said to be contributing to the health of the community. We tried to get some of the stores to sell food, but they refused. And we could not impress upon our local elected leaders to get the stores to sell food. So we ended up this is an example of one of the stores. You see the picture of this store, Jimmy's Super Saver, right? It is in the worst performing census tract for violence, for children's poverty, for female-headed households. And you can see that we did another Freedom of Information Act to get the latest lotto figures. So this is from 2022. This census tract of 2,598 people had sales of $254,830 in the lotto. That doesn't match, does it? It just doesn't work. So here's the place where it is, and here is on the right just a series of items about the shootings in front of that store, the stabbings, etc. So I think you can clearly see that with this example, the corner stores are not contributing to the neighborhoods in which they reside. So the good answer to this, and my students were so thrilled. So we gave our publication on the lotto, on the corner stores and the supermarkets to every community member we could find. And then we made slides and we taught all the community members to talk the slides. We taught them how to say, how to interpret for the people that are the listeners, the epidemiology of it and the anthropology of it. So they eventually used this. Now, it took a long time. The paper was published in 2008, and this store was put in place 2015, but it is in the major food desert. It's a full service, clean, beautiful grocery store with enough space for cars to park in front. So this is, even though it's not like some of the work we did in Egypt, for example, or Nigeria, where we were successful in Egypt on the maternal mortality study with bringing down the maternal mortality in hospitals. This is a very small accomplishment, but I feel kind of proud of it. Anyway, the next one we were invited to the Emmaus Clinic, which was run by one of the churches in the center of Syracuse, forgetting the name, Church of the Assumption, I think, or could be Church of the Immaculate Conception. I'm a little unclear about exactly what. So we we said, well, do you have anything that says, who are your patients? And the person who is Dr. Lynbeth Satterley, this woman right here, who is my buddy now, she was the physician who put the clinic together. And she said, no, we don't know who our patients are. I said, well, you have patient charts, right? She said, yes. I said, okay, we will have to get approval from Syracuse University and Upstate Medical University to review the charts. And we'll have to come on times when the clinic isn't working because we don't want to interfere with the flow of the patients. So we would go there on Saturday afternoons and Wednesday afternoons. Anybody who could come. At a certain point, I had anywhere near 6 to 10 students reviewing charts. Many of them had never read a patient's chart. So I had 4 high school students working on that project, 5 medical students, 2 doctoral students, and the rest undergraduate students in public health and anthropology. So the students would teach each other. We had medical books where they could look things up. So first we did the 600 patient chart review. And here's what the students put together as a slide. They said, the patient charts are terrible. We can't read them. Look at this. Could you read that? It's really hard. We said, you're likely to be having, some of your providers could be making mistakes because they can't read the patient charts. So the first thing they did with our analysis, which we ended up publishing, but we gave them the analysis first, they asked my students to come and give a formal presentation to the Monsignor and all of the board members of the Mauss Clinic, and we did. And they used that to get the money for an electronic medical record. So they don't have any handwritten patient charts anymore. I'm very, very pleased. We also did qualitative interviews for health literacy and patient life histories. And so those are published with all the students and Dr. Satterley as co-authors. So I'm going quickly because I want to show you what some of these things are. We next worked with Noble and Naja on neighborhood violence. So Noble came and talked to me and said, well, there's a lot of murders out here. I said, okay, you want to work on it? He said, yeah. He said, okay, let me get a couple of faculty members and Robert, and they immediately gave us nicknames. They called me FG, Fairy Godmother. I think they thought I was like Glinda the Good Witch or something. But now everybody in the community calls me FG. Hey, FG, people call me for rides. Hey, FG, can you give me? So the first thing we did, I knew that we needed some sort of a foundation. So we did a survey of the community. And I knew we couldn't send our students door to door because we had at that time the highest rate of murders in New York State. So nobody wants to send our responsibility as professors is to keep the students alive until they graduate, right? That's at least what we should do. So we had to figure out how to do this survey in a way that would reach most of the people we wanted to reach. We had approval from the IRB to do interviews without taking names, but interviews that were only of age 18 and older. So we did it at the Juneteenth celebration downtown, which draws many of the people of color from the hardest hits neighborhood. We didn't limit it to any one racial or ethnic group, but because we did it also at a Pop Warner football game and a braiding salon. And in each case, the student went with a community member, so there was equal representation of both groups. The first thing we did was the civilian PTSD checklist, which matches the PTSD checklist used by the military. And 52 of the people who answered it screened positive. And you can compare this to are returning veterans from Afghanistan and Iraq, where 22% of them screened positive. And then we asked them, how many people do you know personally who've been murdered? And at that time, I didn't know anybody. No, and so here you can see, if you do sort of an average of all of these, most people knew 5 or more people who had been murdered. And even Noble's son, Samir, who's graduating this next year and he's flying to college and he's a wonderful kid. He's had 5 friends who've been murdered. So we did that. I worked with Naja, Noble's wife. We went to Hope for the Bereaved. And we said to them, well, we have this problem with bereavement in the community, and we need to know how to fix it. And so, I mean, fixing it is not exactly what we said, but we needed advice from them. They were truly appalled by what we had to say, because they were used to helping somebody, let's say, whose loved one might have died of lung cancer. That's one death at a time, and lung cancer isn't coming back to kill the kid next door like the violence does. So they said, we do not know how to help you. But Naja developed this beautiful project with the kids, which involves art and some therapy, which they don't call therapy. They bring in social workers of color to talk to the kids each week. So that is one of the things we did. Another thing is we realized that a lot of the professionals who are working with the traumatized population in the hard-hit areas with a lot of gunshots, which you'll see next, like teachers, EMT folks, police, you get the idea, outreach workers, they have a lot of trauma themselves. So we hosted 2 huge workshops. Each one was, people really wanted to get into it, and we could have hosted a whole bunch more, but we figured 2 is a good start for that because we had to work with the kids. And at those workshops, they told us what they needed and what they were facing. And they were having real difficulty. So after that, we had a split off group who started working with the EMTs. And that's become something that my whole department of public health has worked on, the EMTs and their emotional responses to the violence. And then later they worked with them on all of the people dying of opioids in the community. Okay, then we went to the police, and the police chief at that time was our partner. We made a partnership with the police. Doesn't mean the police always do exactly what they should do. I don't think any profession has people who always behave properly. But we felt like if you're not partners with the police, then you're never going to be able to make changes. So we partnered with the police, and they gave us the data that you see on this slide. Now we've gone back to the police, and we have the same data all the way up to 2024. Every single gunshot, every single injury, every single homicide, right? And so you look at Syracuse, this is Syracuse, and it looks like a heart. If you think of the heart that's in our chest, there's a freeway that goes up and down and a freeway that goes side to side. So there's 4 chambers of the heart of Syracuse. And here you see, this is where the poor people tend to reside. Syracuse is not a wealthy city, so even over here, people can be poor. But this is where there's a lot of segregation and a lot of poverty. So, so if you look at this, we then did a study. We figured, okay, gunshots are important, but we're not criminal justice people. We want to find out what is the human cost of the gunshots. So we did a few talks at the various local schools, elementary schools, and the teachers shared with us what they're facing. And then and what they said is it's hard to teach the kids, right? For example, there's a school, right? These yellow dots, these tiny little yellow dots are gunshot episodes. And those are from the police database. And the gunshot episodes have more than one bullet fired at a time. Here we don't have the homicides or the injuries, just the gunshots in a 5.5-year period. And then if you look at Syracuse and you look at all these different color chunks that are various colors of blue, those are the catchment areas of one or more of the 19 elementary schools, public elementary schools in Syracuse. Now, the sad tale is that in Syracuse, reading on the third grade is hopelessly behind. There's about between 20 in 2019, and then I looked at it for 2024. 2024, only 20% of third graders in Syracuse were reading at or above grade level. But in the schools right in here, where they have all the gunshots, it's much lower. And there's only about 2 or 3% of the kids who are reading at or above grade level. For anybody who doesn't know about grade levels of reading, if you read the Berenstein Bears books to your kids, that's third grade. So imagine not being able to read better than that. So we could say for sure that there was a spatial association of gunshots with low reading. Now, the person who put this slide together was a junior in high school, Anthony Pineski. He asked to work with us, and I said, okay, I want to have you learn quantum GIS. And he did, and he put all of this on the map. Isn't that amazing? And we've published from this. Okay, so now we're on to violence. This is old. It's been added to. This is a memorial plaque made by the kids in Noble's group, Street Addiction Institute Incorporated. And these are the kids who died in the murders. Not all of them, but the ones that they, yeah. We published about that, about the mourning practices of the children, the grieving practices of the children in current anthropology, and you'll see that's in the references. So we've worked with Noble and his team to help him put together. First of all, they have their own 501c3. They write their own grants now, ever since 2015. They've gotten a major grant from the city of Syracuse, from the county, from family court, to enroll kids who've had one brush with the law to prevent recidivism. Before they got that grant in 2015, there was 85% recidivism for kids who had been arrested during their early teenage years. Now, of the kids that Noble and his team take care of, that's 150 kids per year, about 60 of them are referred from family court. And well, the other ones of them are are referred from their school district or volunteer. So they take care of about 150 kids a year. They bring them to all kinds of presentations. I took the kids to Les Miserables in Syracuse. They didn't like it at all. I took them out to dinner. So they have ongoing after-school programming. with street addictions. If they can't stay in school, street addictions finds a place for them to keep going to study for their GED or whatever. A huge number of the kids have graduated from high school. I guarantee you, before street addictions, that was not the case. And many of them are going on to college, starting with community college in many cases. But the kids are seeing a future for themselves. And we recently visited the police and, as I said, got another whole download of data. And so the happy news, we're not done yet. There's a lot more work to do. But murders, since Noble started his and Naja's not-for-profit, and they're not the only people, but they're a big part of it. Murders are down by 30%. So I'm very happy about that. Okay, lead poisoning. That's now still a problem, and we've tried our best to work on it. So we were asked, I don't have a lot of nice pictures for lead poisoning, but anyway, we're asked by people in a group, a local group, the lead poisoning community group, to do a cost analysis about how much the poisoning of children by lead costs the city of Syracuse. Now, you should know that we have 3 times the lead poisoning in children of Flint, Michigan. We have among the highest lead poisoning in New York State. It is truly unthinkable and inexcusable, in my opinion. This is one of the things that still hasn't improved yet, and it makes me really mad. So we worked with a lot of other people, like 200 other people, to push the Common Council to write a new lead law, a local law preventing children in rental properties from getting lead poisoned. Because previous to this lead law, we only knew if property had lead in it when the child got poisoned. The rental properties used poor children as canaries in the coal mine. And even now, it's only a little bit better. So we helped pass that law. It was passed in August 2020. Then we tried to get the city and the county to do what they pledged to do in the law. It took another 4 years for them to act. You can tell by the tone of my voice what this took out of me. We helped our community partners to establish their own 501c3, which includes raising the money for the legal costs, getting Syracuse University Student Law Clinic to help us enter the legal fees and do all get everything properly certified for them to be able to raise their own money. We met with community members over and over for a year and a half every Friday afternoon to hear what they were doing. And then after that, we looked at all the local data and proposed to them a set of priorities based on what they had told us. It wasn't me setting the priorities or Robert, it was their priorities. And then we got them to vote on the priorities. And those are the priorities that we've worked on ever since. And we published that article in Annals of Applied Anthropology in 2023. We assisted the CEO of Families for Lead Freedom Now to give pediatric grand rounds. And so that helped because the pediatricians were not testing the children for lead as much as they should. We found out that only 50% of the children who should have been tested were tested. So we started working on that. Then Robert and I served as pro bono consultants to the state attorney general's office to give them the local data and help them understand all the priorities that the community has set, et cetera, to be able to prosecute one of the worst acting landlords. who was a part of a landlord corporation of slumlords who had consecutively poisoned 18 families of children. And I personally think that guy's going to hell. Okay, so then here's on the left, lead poisoning in 2023. I'm sorry, 2013. What am I saying? And here's the gunshot map. Do you see any connection between those two maps? We're working on that right now for an article. We believe, based on the individual level biological data, that gun violence or violence perpetrated by adolescents is higher among those who've been lead poisoned as children, because lead poisoning causes apoptosis, which is brain cell death, and it leaves little places of tau deposit in the brain, which is areas where the brain has died. And so that makes the children less able to learn. We believe it is one of the key risk factors for kids not reading at grade level in third grade. We believe it's a key risk factor for violence in Syracuse. And so we are working on that with one medical student, two graduate students, one high school student, and another student right now. And we're working with Oceana, the lead poisoning CEO, and Noble and Naja as well, and the chief of police, and probably a host of characters. Okay, then we started working with our students and with community partners on refugees. Dr. Andrea Shaw was my medical student when she went to Upstate Medical University. In 2003, I was teaching an engaged learning course for the medical students with an obstetrician, and I would bring the medical students out. Each two groups of medical students had their own pregnant woman in the community who had agreed to help teach our medical students. So Andrea wanted to do more, but in this case on refugees. So we've done a lot with Andy on refugees. We've conducted lead poisoning focus groups. We've done a chart review of refugees and who in Upstate Medical University and their lead levels. Were they lead poisoned after coming to Syracuse or before coming to Syracuse? Also, to tell you the truth, tragically, 4 refugees have died in the violence that is in Syracuse. And we've conducted a study of refugee births with medical students who are working with us. Actually, the study of refugee birth was to give them a chance to get into a good residency. Anyway, okay, so we have the 3rd highest per capita receipt of refugees in the United States. In that analysis of refugee births, I figured out how many of the births in Syracuse are to the foreign born. That doesn't mean they're all refugees, because some of them might have come here as voluntary migrants. And it's nearly 25% of the births in our city are births to foreign born people. This is, I think I did it. This is if you look at these are the references from the CARE projects, and you can see that the yellow highlighted, they're all the students, and the blue aqua are the community members. So I'll stop sharing if I can figure out how to do that. Yeah. There. Tim, did I finish in time?
Yes, that's great. Yes, that's great. So I'm going to just open the floor. I'm astounded at all the local work that you
You
and
can do a lot when you're here, and you don't have to get an airline ticket to go there. I
so
can't tell you how much of this I did from my recliner in the study.
Well, it sounds like you had a lot of work to do with meeting with groups and individuals and a lot of
Yes,
follow-up over and over, on a weekly basis. So just an
yes.
amazing amount of work. So I wonder if Robert, did you want to say anything about your collaboration?
The only thing I want to say about this collaboration is that I consider, and I've said this before, so this won't be a shock to Sandy. I consider myself to be a junior partner in the local work, since I'm doing other stuff on peace operations and violence and so on, including working with this Clementine Fujimura. I don't know why I mispronounced her name. Um, so anyway, no, I don't really want to add anything.
Okay. So does anybody have any questions or comments? Yes, Alice, go ahead.
Alice,
Yeah, Alice,
Yeah,
go ahead.
I remember years ago, Sandy, that you sent me a paper or summary of it that you did a study about violence um, done to or by kids and related to whether they were living with both parents, fathers in the home or not. And as I recall, you had astounding figures supporting the importance of two parents, the father specifically in the home. Would you like to comment on that?
sure. So in it, Robert does peacekeeping sort of in addition to this work,
Yeah.
and I'm in OBGYN, so I'm usually working with the obstetricians, and this was a database that I was able to access of all the births in central New York. And we have a lot of people who are foreign born, and this database has whether somebody's foreign born or born in the United States, the mother. So I was able to look at the migrant health effect, which is that migrants to the United States for the first generation tend to have better health than native born US people. So I found that yes, migrants controlling for Medicaid, race, etc., all these other factors, migrants had 22 if the mother was a migrant from outside the United States, they had 22% low birth weight. But when you added in the fathers, that was an extra, I think, 20%. So the dads, all the men, if you're dads, uh, you're worth 20%. 20% of your infant not getting low birth weight comes from the fathers being around, driving the mother to appointments, giving her encouragement, all the things that I'm not trying to make light of what fathers do. In those, there's a whole bunch of those studies in which I try to include the fathers because sometimes you can find the database includes just a few things about the fathers, and I kept saying to everybody, women don't give birth without at least the DNA from the dads, right? And so a lot of what I've done, not so much in these the community health projects, but a lot of what I've done is try to show that pregnancy is a two-person event.
Okay. Marion, I saw you.
Yeah, I think it's fantastic, your report, but it's also deeply appalling. You think you're talking about one of the poorest countries in the world, totally underdeveloped, and
Yeah.
it's gruesome, absolutely terrible.
Mhm.
Now, your study is a little while ago. Have there been any changes
Well,
since then?
we got the grocery store on the South Ave in the biggest food desert. Um, we got the local lead ordinance, and there's a 501c3 of community members who, because when you get your own agency, then you start getting invited to state level things because you have a platform. So our people who we've helped them get their own 501c3s are now participating in state level talks about lead poisoning and about violence. And gradually, I have hope for lead poisoning getting better. That is something that hasn't worked as well. The thing that I worked on first, infant mortality, African American infant mortality has come down by 2/3, but it's still too high, and it's still higher than white infant mortality.
The gun violence
So
has gone down up and down, but down a little bit since Noble and Naja have been doing the street addictions intervention.
violence has come down 30, the murders have come down 30%, but it's still shocking.
Yeah.
We
We
have to, I think we're in one of the most troubled parts of the country. Not all of Syracuse, certainly not our county, but the place that I showed you with the most gunshots, that lower, if it's a heart, the lower left-hand chamber of the heart of Syracuse. That's where we have the most problems. And right now with our students, we're also looking into the history. African American residents in Syracuse and the Great Migration North. We're trying to, because we're writing a book with Noble and Naja. Their first and second author, Robert and I, are the last authors. And this will tie in some of the other stuff as well. It's gotten a bit better, but it's not, I can't say it's that great.
So
I just feel like we have to celebrate every small accomplishment so people don't get discouraged.
So it's worth saying that it's not an accident that this is among the most segregated cities of its size in the country. There is a lot of racism. And when the lead ordinance was passed, finally, after over a decade of advocacy for it, and COVID had passed us, and the county had $85 million in surplus budget. There was a move to spend that money, and the county executive and the folks who sit on the county legislature from outside of the city advocated for and were successful in passing a bill to establish an aquarium in Syracuse, because every landlocked city has to have an aquarium. And and this was over the protests of community members who came to the council meeting and were given half an hour for public comment and then cut off. It was a remarkable display of racism and the functioning of institutions to continue to marginalize members of this community.
I was almost arrested in this county legislature because when they said they were getting ready to let Oceana, the person who started Families for Lead Freedom Now, talk, and they cut her off before she talked, and I screamed out, "Do you consider this democracy?" Because I'm from the Vietnam generation. I was used to lots of protests back in the day, and they sent the police over to me. And one of the Democratic members came to me and said, "Sandy, they're planning to arrest you unless you shut up."
I thought this was a really extraordinarily interesting presentation, very valuable. Just simple question. What were the sources of lead poisoning? What were the actual sources?
Yeah, so what we originally realized and were told is that it is the paint in the underlayers inside the house. 90% of the housing stock in Syracuse was built before 1978. So in underlayers of paint is lead. And this isn't such a big problem on the wall, right? You can put encapsulating paint on the wall, but in the windowsills and the door frames, even if you put encapsulating paint, you open the window, close it a couple of times, there's more lead dust coming out. So that was where we started work. There's also lead in the soil around many of the houses because this was an industrial city. Nobody's worked on the soil. We started working on the houses. And then the last thing we found out after the EPA and the city and the state told us there was no more lead in Syracuse's water because they had done stuff to replace the pipes. Then they found out, oh, we forgot to tell you there's lead in the pipes. So our community partners are working on that. But at that point, I said to myself, how can I work on it if they're lying to me? Sorry, I care deeply about these things and I get really upset when I think we've done everything to help and then, oh, by the way, that was really hard. I have to say, I had to go home and drink a couple of glasses of wine that day. Suzanne.
Suzanne, you have to unmute yourself.
Thank you. This is really an amazing presentation. I so appreciate everything you're
Thank you.
doing. I've done kind of parallel things in Bangladesh as an applied anthropologist. And I really like what
Nice.
you're talking about. But the question I have is, this isn't just any year, is it, in America?
No, it's
You know,
our 250th birthday.
No, well, what I mean
No.
is
Oh.
the Trump folks and all of them, are any of their changes have to be affecting all the
So
cuts
we've
have to be
worked
affecting
with
these
other
communities.
folks in Syracuse, not community part, like there's two guys who are a gay couple and very, very devout Catholics. And they started their own AIDS hospice. That's a Catholic worker house, Friends of Dorothy House. And I worked with them and wrote about them as a chapter in my latest book and helped them because they had some monolingual Arabic speakers and I speak Arabic. So I would volunteer to help their Arabic, especially when they had a woman, because the woman was a covered woman. She wore a headscarf and everything. And she was very, very sick. So I volunteered to help her. So they do a lot. And so these two guys, Michael and Nick, they found out that the person across the street from them who worked in a flower shop was his visitor visa had expired. And they found out that ICE was coming to get them. So they sent word out to the whole community and people showed up and wrote and drove in circles around that place, not letting ICE get to them. And eventually ICE got tired and left. They immediately put that one guy who was at risk into somebody's back seat, put a blanket over him, drove him to the border with Canada. He didn't have his passport. They convinced him to get into Canada. It was kind of complicated, but the Canadian people were very helpful. And they were going to send him to El Salvador. And he got to Paris. He got home. So there's a lot that people are doing. More than that, so I don't want to, we've made plans for, one of my friends called me and she said, I have an extra room. This is Anne Frank time. We made plans for trying to hide people,
I mean, you mentioned refugees, and those people
refugees
surely
are here
targets.
legally, and they have 3 refugee resettlement agencies. They may get hurt, and we're in touch with the refugees. They know who to call. They know what to do or not do. They're less at risk right now from people who might be picked up off the street and have an expired visa or whatever. And we have undocumented people in Syracuse as well, who right now not so much, I guess, but they pick our crops. right? Not as much as California, but a lot. So, but there's so Syracuse is a democratic city with a lot of people who have similar values to Robert and me and probably all the rest of you. And we're in a very Republican county. And so the people in the city, if you have an idea, you can get help. So we're
It's
there.
it's worth
Go ahead. I'm sorry.
it's worth saying that the refugee resettlement agencies here have lost an incredible amount of budget
Funding.
and have had to lay off people and so on. So that has been an immediate and direct effect of the Trump policies.
Yes, and so a lot of us have donated and sometimes volunteered for refugee resettlement help or whatever.
I have to unmute. Can I ask a couple of
Syracuse
things?
loves
Oh, sorry.
we love our refugees. Yeah, sorry,
Yeah.
go ahead.
Yeah, I was curious. I worked with refugee resettlement in Ithaca for a while and was hired by a refugee group, one of the resettlement agents in Syracuse in the in the 80s. And it was
With the Vietnam era refugees, right?
well, no, it was the Hmong,
No?
Lao Hmong.
Ah,
And
okay, well, yeah.
I wondered what if the Hmong refugees are still significant in Syracuse.
Yeah, they're
And I've
running
got
for
another question,
office.
but I'd like to hear that first.
They're running for office. They have law degrees. Some of them are
Wow.
doctors now. Yeah, I mean, the 3 refugee resettlement agencies, they don't have enough money. They and there's a lot of us who volunteered to help in other ways other than this community health work that Robert and I do. And we have refugees in our schools, in our classes. We have and there's we've helped refugees apply to college. The refugees do really well. Not
That's
all of them,
interesting.
of
There
course,
was a
but many
problem.
of them.
Yeah, there was a problem because in the early 80s, basically the resettlement groups, whoever was organizing things and maybe from Washington, resettled the wrong combination of clans because they totally ignored,
Oh, yeah.
of course. So,
That's still
and they asked us to figure out why they were losing so many refugees. Well, it didn't take long to say you've got 2 groups of wife takers and no wife givers. So they kind of exchanged.
oh,
Clan
yeah.
groups came in from
Yeah.
one group went to California and another California group came to Syracuse.
Good.
Oh, that's wonderful news. But could I ask you something else related, of course, to infant mortality? Was there any community interest in having more support for breastfeeding? Or is that
Yes.
something that comes
Yes.
from public health, but
It's
not a
something that
felt need?
yes. So in terms of breastfeeding, one of our local birth hospitals, St. Joseph's, has passed all the 10 steps of the baby friendly hospital plan of UNICEF. That was done years ago. With Syracuse Healthy Start, the agency that I founded long ago in 1987, it's still running, and they have breastfeeding promotion with people who are lactation consultants. And they had a lactation consultant. I don't know if they do anymore. I haven't looked into that specifically, but they had a lactation consultant of color because that was important because the people of color weren't breastfeeding as much. And then one of my students worked with a local community hospital in Auburn, New York, to help them establish the first 3 of the baby-friendly hospital steps for breastfeeding. So there's a lot more problems. OBGYN is struggling because the women are sicker. And there's more more maternal mortality, a little bit more, not a lot. The OBGYN docs do a really good job here. I've reviewed their evidence for other things, and they do a really good job. But they can't. I mean, if somebody's exposed to domestic violence or
Oh,
other
yeah.
things. They can't be with the woman 24/7.
No. What I was thinking though, the initiatives sound really important as they are in lots of communities. But I wondered when you have your community meetings, is this something that the community, is it a felt need or is it sort of not mentioned by people in the
Well,
community?
some
You'd
of the
rather have,
community members are quite conservative about talking about body parts.
yeah.
So we wouldn't have it as a community meeting. It would have to be with women.
Mhm.
And yes, this Syracuse Healthy Start holds groups of what they call consumers, which is their women. We now have to call them persons with uteruses.
Oh, right. And
Yeah.
vaginas, yeah.
It's not women giving
That's
birth
true.
anymore. It's those who have uteruses. Anyway, I don't mean to make light of that, but so yeah, they do talk about that with their clients and with groups of
Mhm.
of consumers. Yeah.
Thanks.
Anyone else? Sandy, I was just struck by the fact that you brought so much experience to the work you've been doing in Syracuse with Robert and your other collaborators. It's just amazing, because you have such a long set of, I mean, a varied set of experiences in your younger days as a nurse and in the working in hospitals and stuff like this. So you're really in a unique position intellectually, professionally, anthropologically to be able to help out people. And I think it's just really, really wonderful that you've been able to do these terrific projects in Syracuse. And I, like Marion, am astounded at the level of
Trauma.
trauma, poverty, the issues that here we have, as Marion was saying, it sounds like some places in Guatemala. I mean, I'm in Guatemala now, and I look out and say, well, there is some violence. I'm sure there's some PTSD, but you
Yeah.
know, mostly people are not going around hungry and are living in a lead-filled house.
Yeah.
So, you know, there's a lot of things to do to make America great again, and one of them is to really uh, devote more attention to helping people in the cities. And
Yeah.
this, the environment in which we are in, it seems like the cities are seen as the enemies rather than the allies that they should be, and they're part of our citizens. So it's unfortunate that, well, I'm getting into politics now, but I just wanted to say that it's just really just amazing work that you've been doing in Syracuse. And when I heard about it, that's why one of the reasons I wanted you to talk to us.
Thank you so much. Thank you, everybody.
Mhm.
Well, let me just add a couple of things here.
Yeah.
I put Sandy's latest book into the chat for anybody who might be interested in it. It's Behavior, Belief, and Health, I guess. Also, Syracuse Healthy Start began in 1997 or 8.
7.
Yeah,
No,
Sandy,
97. I'm sorry.
yeah, misspoke.
I lost a decade there. 80s, 97, sorry.
And finally, any of you want to come visit our aquarium, we're happy to take you there.
You know, we've had the highest child poverty rate in the nation, and the aquarium is going to charge $15 for each child.
Oh, no.
Oh, God.
I said to them, you better make the aquarium out of bulletproof glass, or some of the kids are going to come and shoot it. I don't mean to laugh at gunshots, but
Wow.
yeah.
I have a footnote question, if I may, just a footnote. Did you know Margaret Clark at UCSF?
Oh, yes. Margaret Clark,
I was
Joan
a
Ablon, Fred
Mm.
Dunn.
Fred Dunn. Yeah,
They're
I
my
was.
heroes. Yeah.
Oh, we know the same people. I was a research anthropologist there for several years.
Nice.
Worked with Fred and, in fact, went to Malaysia. They had a very, very large research project. But She was very effective, Margaret.
She was wonderful. Yeah. And I learned a lot from her. Yeah, from all of them.
And aren't we all a little bit 6 degrees of separation from Joan Ablon, right?
Yeah.
Joan Ablon introduced Robert and me. So she
Oh,
arranged our marriage.
wow. Joan Ablon got me Fred Dunn's. I was trying to track him down, and I interrupted her at dinner at a meeting of the Applied Anthro Society to get his address, and she gave it to me.
Good.
So these are
Yeah.
the little things that count, you know.
Yes. Yes.
Absolutely. Yes.
Thank you.
Okay, well,
Thank you.
I'm going to mark the end. We're going to have our next chat on January 22nd, I believe, with Alex Moyer, who is at the University of Hawaii, who will be talking about his work in French Polynesia and Hawaii. So, Sandy, mil gracias. Thank you very much. And Robert, thank you for being here too. And for all of you, thanks for this. And I can't wait to get this up on our website because I know that there's going to be a lot of people that want to hear this. Really great talk. Thank you very much.
Thank
You okay?
you.
Thank you.
Okay. Have a nice holiday, everyone. Take care.
Yes.
Bye-bye.
Happy winter solstice.
Okay, bye-bye. See you, Robert.
Bye.
Bye.